it's actually not the sacroiliac joint that is contributing to their symptoms. It is the superior cluneal nerves, which can sometimes mimic sacroiliitis. So something that people need to be a little bit more open with, and this may be you, this may not be you, but just hear me out on this, is you might need to be open to the idea that the diagnosis that you've been given for why you are in chronic pain may not be 100% accurate. Now, there could be a spectrum of inaccuracy, meaning this could be 10% inaccurate, or it could be 98% or 100% inaccurate. No way for me to know, through this video what your percentage is. The way that I determine that with my patients is going through a in-depth medical review where we do a physical assessment, we review imaging, we might get new imaging, we might do other diagnostic tests. We, kind of take a look at the big picture. That's how I might know. So an example is somebody might come in and they've been given a diagnosis of sacroiliitis, and they've had injections into the sacroiliac joint, and that has not been effective. So then let's say we do a physical assessment, and I actually determine that it's actually not the sacroiliac joint that is contributing to their symptoms. It is the superior cluneal nerves, which can sometimes mimic sacroiliitis. That is an example where it is basically almost 100% inaccurate, the diagnosis they were given, and no amount of sacroiliac joint treatments could be actually, could be beneficial for them. Another example is where they've been given the diagnosis of sacroiliitis, and they get an intra-articular injection and periarticular injection for the ligament, and let's say they get 50% better. That tells me that maybe there's 50% of their problem coming from the sacroiliac joint and supporting ligaments, but there's 50% of something else, and we got to figure out what that is. We do a little bit more digging, and let's say our physical assessment and imaging review and our diagnostic tests reveal that the middle cluneal nerves and the iliolumbar ligament are contributing to some of their pain. In that situation, now we have kind of three pain generators. We have the sacroiliac joint and ligaments, we have the iliolumbar ligament, and we have the middle cluneal nerves. And so in that situation, 50% of that diagnosis was accurate. And so sometimes, in order to find the relief you're looking for, you actually have to step back, and you have to maybe find somebody who's willing to take a new look at your problem, at your chronic pain, so that way you can figure out, from their point of view, what might be different. Sometimes you have to be able to step back and think, okay, I've been diagnosed with sciatica, but maybe this actually isn't sciatica. It's another common one that we see where people are given that diagnosis, and sometimes, a lot of times, it's not that diagnosis and it's actually something else. So be okay with stepping back and be open to receiving maybe a different idea for why you're in chronic pain. Because if you've been given a diagnosis and treatments have not been working for that diagnosis, maybe it's not the treatments that are incorrect, maybe the diagnosis. Something to think about.